Healthcare has a trust problem, and trust is lacking, it feels like, from every direction. And it goes beyond the healthcare system. It's so many of those components that support and interact with the healthcare system as well. So we're having this webinar to give you a background of the Medipreneurs National Nurse Practitioner Entrepreneur Program workshop that's coming on June 2nd. We look forward to telling you more about that as we go, but most importantly, introducing you to all the key players so you can understand why we're doing this and where it's going. My name's Michelle Fritsch, and I'll start by introducing you to Medipreneurs, which is an organization that networks and supports health professionals who have become entrepreneurs. We do not learn in any of the medical schools very much about starting businesses, growing businesses, understanding businesses. And in addition, we've noticed not only as practitioners, but as entrepreneurs, so much of all things healthcare are so incredibly siloed. So we're also striving to take a very interprofessional look at how to support business owners, how to support changes in healthcare moving forward based on all of the innovative ideas of the people in Medipreneurs. I'd now like to introduce you to Lynn Rapsilber to tell us more about the National Nurse Practitioner Entrepreneur Network.
Thanks, Michelle. For those of you out there, the National Nurse Practitioner Entrepreneur Network, or NNPEN as we call ourselves, we exist to empower nurse practitioners to lead, to innovate, and to thrive as business owners by advancing education and collaboration and building sustainable practice models. Nurse practitioners identify needs in their communities and want to build practices around that. We're grounded in the vision that nurse-led care is a commitment to integrity, transparency, and shared success. And we try to foster that community where trust is not assumed, but it's built through the connections that we make as colleagues with our patients and with our communities. And we understand that healthcare cannot change without the support and collaboration and trust from other disciplines. This is the foundation of which NNPEN's partnering with Medipreneurs as an extension of this mission, creating that space for open dialogue, learning from each other, and relationship building with clinicians, navigating the complexities of entrepreneurship. And when we start engaging with each other, we can share our insights, our experiences, and support innovation. And we'll not only strengthen ourselves as individuals and our practices, but the profession as a whole. So this workshop continues its mission, and I hope you can join us to create that momentum that we're doing in changing the healthcare ecosystem. So I'm excited to be part of that process.
Thank you. Changing the healthcare ecosystem. You know, if not the innovators, then who's going to be in the best position to do that? So excited to be pulling everyone together for this. So now it is my distinct pleasure to introduce Brigadier General, now retired, Mark Towne. General Towne has built trust in some very interesting places, from the front line to the Pentagon to boardrooms, and now with businesses across the country. I want to hear more about you, but also why trust? Of all the things you've experienced, why are you focused on trust?
Well, okay, so Michelle and Lynn, thank you for the opportunity to be part of this team that's going to, put on this event and carry in June. Give a little bit about my background. I spent just under 35 years in the United States Army. I enlisted as a private back in 1986. April 1st, 1986. So think that about that date, that stuck with me for 3.5 decades. I became part of this organization that trust is at the very foundation of the entire culture of the of being a soldier. There's a manual, there's a manual for everything in the military. And if you look at the leadership the Army Leadership in the Profession Army Manual. It's 160 pages long. Trust shows up there around 180 times.
Really?
And they don't, it's not by accident. Why is it? Because it is at the core of the profession, meaning trust up, trust down, and also trust with the American people. Take it very, very seriously. It's a political organization that it's, the constituents are you serve the people of the United States. And so, so you enter this organization, you don't really think about that too much, because it's part of the culture. And and you know, when I was commissioned as an officer, I went in the Army Reserve. Now, part of the Army Reserve, so our United States Army has three components. Got the active component, the National Guard, and the Army Reserve. And the Army Reserve actually started out in 1908 as the Medical Reserve Corps of the United States. It was a holding formation for medical capabilities that the nation had to put on retainer, basically. It's because you can't keep these people on active duty all the time. And when you look at today's Army Reserve, again, it's one of the three components. Um, it is of all the Department of Defense medical assets, the majority of them come out of the reserve components because people that like are on the line here, they do something else during their regular job, but when the nation needs them, we mobilize them. And so, I spent 35 years, I was on active duty, all that time. And again, got enlisted, got commissioned through ROTC as a lieutenant, made it all the way, to Brigadier General in the Pentagon as the G3, the Chief Army Reserve. Basically, that's the chief operating officer of this component of the Army, 200,000 people in 30 different countries. So when you think about trust, right? So you're in this environment. It's not just a word, it's part of the ethos, it's part of it's part of the culture, right? And sure, you get people who violate that trust, just like any big organization. But at the end of the day, it comes down to the values of the institution are oftentimes self-correcting because trust is so powerful. It's not just something that sits on a website or a slide or on the wall of an organization. And so, as I was moving through my career, and I've told you this story before, and we'll get more into this at the workshop, about the power of trust, not just aspirational trust, but operational trust. And how that makes a difference in building commitment in people, performance in people, and value generation, the results that you have to be able to achieve. And when I was a major, I had the opportunity to spend a year with the Marine Corps, and I in Quantico, Virginia. And during that time frame, I got to meet a Supreme Court justice, and the Supreme Court justice challenged us that, hey, have you ever read the Federalist Papers? And if you haven't, you really don't understand the oath of office that you take, which is to support and defend the Constitution of the United States against all enemies, foreign and domestic, bear true faith and allegiance the same. And so, of course, we read it, and his challenge to us was, when you ask people to go into harm's way, to do some really difficult things, that oath can't just be words. You got to understand, what happened behind it. And so this journey on trust was like, okay, got it. So the next year, I'm in Baghdad, Iraq, and I'm watching the Sunni, Shia, and the Kurds, kill each other for a lot of different reasons, right? And I'm sitting there thinking, wow, how awesome it is that we have a constitution in our nation that would prevent that from ever happening. And when I got back, my eyes were like, oh my gosh, that's happening right here in our own nation on multiple levels. So I really started paying attention to trust, okay? Not just this aspirational trust, but what it means to, in people's lives, in our communities, in the organizations that we serve. And um, I got to go, the next role I had, I got to go to Capitol Hill and with some military leaders, and I met the longest serving senator in the United States, and I won't share his name, but he was really concerned about trust in the nation, not just because of what his party was doing, but trust in the nation. And I'm like, wow, this is a really important thing. Study this. Now, fast forward a few years from that I get selected to command an Army battalion. If you're not familiar with military organizations, so you got a couple soldiers make up teams, teams make up squads, squads make up platoons, platoons companies, and companies are what fill out battalions, and battalions brigades. So as a battalion commander, it's that real first level, real large organization. And my boss, I meet my boss and find out that I get assigned the organization I'm leading is kind of the bad news bears. It's totally broken. I mean, there are things just all sorts of bad. And he looks at me and says, the most important thing you can do now with your battalion is to build their trust. I'm like, yeah, I got it. I understand that. And he just now I'm not a big guy. I'm 5'7". He's this, uh 6263 West Point Airborne Ranger, all the merit badges. And he's like, hey, Town, come here, sit down. We need to talk. And so he looks at me and he just tells me to stop talking. Okay, which is hard for me because I talk a lot. But he said, just stop talking and listen. And he tells me the most important thing you can do is build your trust, but you got to understand something. He goes, you got to understand that you have to build and earn their trust and do it to the degree that if you ever have to tell them to do something that they know they won't come back from alive, that they'll do it. And so, I mean, so yeah, I'd been to business school. I brought all these business tools to the problem set, but he overlaid the leadership imperative about what trust actually means in an organization like that, where leaders are creating, not just having this binary uh, uh, trust relationship, but the ability to actually create the conditions for trust to grow in organizations and in the ecosystem that you influence. And long story short, in 2 years, we went from number 8 out of 8 in the brigade to number 1 out of 8. So from the tail of the spear to the tip of the spear by trust leadership. And what that did is that really, you know, drilled into me that this trust thing, it's not just, I mean, it's really powerful. It makes a big difference. Now, fast forward, why did I get onto trust when I left the military? So, I thought I was going to retire as lieutenant colonel after that role. Instead they, ended up uh, getting promoted to colonel, brought back to the Pentagon a year later. They sent me to go work for the Air Force for 2 years. I lead an organization of 42,000 people, second largest employer in New Jersey, where again, back to you can't command and control something like, I mean, there are command and control mechanisms, but the necessity to is for trust there. I mean, that's the core. You have to be able to influence people and build trust with people who just don't want to have you in their space sometimes. Um, and instead of retiring again, get pulled back to the Pentagon, you get promoted to colonel, and now I'm a general officer as the chief operating officer of this 200,000 person organization. And so this long story, I'm going to chop it off here. Um, as I'm about to retire from the Army, actually, I wasn't retired yet. I was in the role for 3 years. COVID was just about, we were in the middle of COVID kicking off. And my wife and I, hey, the Army's going to move me to something else. They're going to fleet me up. Uh, you know, how should we handle this? So my wife and I went to spend 3 days on a beach praying. Just, God, what do you want us to do? And at the end of that 3 days, it was go back to my boss, tell him I got a different mission, time to leave the Army. And because on that beach, my personal mission statement, build trust among leaders and communities of interest to solve strategic problems of our time. Because when I look back at 3.5 decades, what was the competitive advantage in every organization that I served, in every audience that I was in service to? Trust was the competitive advantage, the ability to build trust with people, the ability to create conditions for trust to exist. How I was going to do that? Okay, going to go to corporate America for a while, write a book, and start Vets Leadership LLC. Vets Leadership does not stand for veterans, even though I'm a veteran. It stands for Values, Education, Training, and Sustaining, which is the source code in this book. And I spent 2 years in corporate America just looking, wow, what does the rest of the world look like? Starting your own company. And what I saw was this vacuum in
Mm-hmm.
leadership and specifically trust leadership. And so that's, I'll stop there, but that's how I got on this trail of, you know what? Um, it's not aspirational, it's operational. There's a gap in, out in the world, just like there is, I mean, everywhere. You can find the opportunities where trust needs to be improved. And as leaders, we have a choice. We can try to, stand back, or we can step in the breach and try to help.
It always strikes me when you say that you were in Afghanistan and you saw the lack of trust and the horrible impact of that. But you thought all would be different when you got back to this country, and that was not the case. This just hits me like a tidal wave.
Well, and there's a lesson in that, because point being is we all look at the world through our own experiences. I mean, we've got a bunch of inputs, right? And yeah, I'd been in a lot of different places that were tough, and really, diverse organizations, and had all sorts of people that have worked with me and for me, and you know but I had a blind spot in terms of, because I mean, that oath of office is really important. The I support and defend the Constitution of the United States against all enemies and foreign domestic, bear true faith and allegiance, same, and take this obligation freely. I mean, and then the soldier's creed. I'm an American soldier. I'm a warrior member of a team. I serve the people of the United States, and I live the Army values. Okay, those are not the reason they have those is to show people that they're not just ideas,
Hmm.
but you serve an idea, and you're serving the American people, that this is the life that you must lead if you're going to stay in the institution. And if you're not, you're going to, the institution's going to be pretty draconian to roll you up. Now, you get back out in the world, things are a lot more flexible like that, but you see that, I mean, you know, what I've also done is, in addition to my stories in the book and what we'll talk about at the workshop, is I did a lot of research to kick the tires on this idea about trust. Okay, 3.5 decades in the Army, but what does the rest of the world look like? And you got corporate leaders that I've interviewed. There's peer-reviewed research all over the place about the power of trust leadership. Yet it's really hard for people to grasp. How do they take that and do something about it in your life? Because
Hmm.
it can get pretty discouraged. Okay, got it. See that things happen in our own country, in businesses, in government, in our communities, in personal relationships. Well, you can do something about it. You just have to choose to do it, but you also have to be equipped to do something about it. So
Which gets to the
yeah,
workshop,
which
is
gets to the
being
workshop.
equipped to be a trust leader. Like, what
Yeah,
does that really mean?
yeah. So what again, part of the lesson that I learned back to that battalion command was that, as a leader, trust is not just some soft skill that it's often framed at when people talk about trust. That it's not something that you can ignore as a leader. It's
Mhm.
something that it's actually a material asset when you look at it through a leadership lens, because then you can proactively do some things. And one of the things that I learned is that, when you're a leader of an organization, again, whether it's in private sector, public sector, small, medium, large, or even if you're an individual contributor that you want to influence the world around you, you're still a leader. Okay. And because leadership is about influence, management is about control. And we'll talk more about that at the workshop too. But as a leader, you have influence. And in order to engage the environment around you, you have to be able to hold some things in tension,
Mhm.
meaning you got to be both optimistic and pragmatic about trust building, because as you know, especially in the healthcare community, you see a whole bunch of different types of people. They come with all sorts of experiences that you can't predict, right? So you have to be pragmatic about things, because you got to understand that no matter what you do or say, people will take your service, and they'll take it for granted too. Some will. Others will appreciate it. But you don't let that bother you. I mean, you can let it bother you, but you don't let that stop you as a leader. You actually, okay, you have to understand that to get at the other point about, people will come to you with Some are more trustworthy than others. Some are more trusting and less trusting than others.
Mm-hmm.
And oftentimes that's because of some bad things that happen to them in their lives. Again, you don't let that stop you, but you have to understand that so that you can help influence them to the place where you can help lead them from one place to another so it supports your vision that they they may we're all broken in some cases in some way I should say, but you get them to the point where they can increase the commitment to the shared vision that you're trying to create as a leader. So and we'll go more in depth than that because it's important to understand that as a leader so that, and even in the moments of frustration, if you have an understanding of what's going around you about this trust, what I call the trust ecosystem, um, it's you're in a lot better place
Mm-hmm.
to be able to handle it yourself, but also to be able to influence others to be able to create these conditions for trust to grow.
Very good point. Obviously, these concepts around trust were not built in the healthcare setting. However, on April 1st, Charlotte had its first ever Health Innovation Day. A couple of you were there. It was dynamic. I kept thinking of the brain trust in that room. So many people, doctoral level researchers and health tech originators and funders and practitioners of every kind. It was dynamic. What did you take from that you feel adds to the relevance of this workshop at this time for healthcare innovators, healthcare educators, and all the businesses that kind of support healthcare?
So yeah, first of all, it was one, thank you for inviting me to that because again, I'm not a medical provider. I've been injured in a lot of ways, so I've received a lot of medical care services. Um, I've got two sisters who are nurses. Um, my son is in medical school. He's going to be a doctor. And again, the organization I was in, with I mean, we had various levels of hospital. So again, I've been with the medical community from
Mm-hmm.
an not a conducting operations, but an operator, right?
Yeah.
How do I get medical providers into into a problem set? Um, and so by going there, the first three panel members, so you had these panel discussions, right? And what struck me most was here's a bunch of people from different aspects of the Rubik's Cube. Okay, you had physicians, nurses, supply chain people, device providers. I mean, the developers. You
Yeah,
had innovators.
everything.
You had all sorts of cats and dogs. On the stage talking about how they were viewing their thing. But in the first three of the day to kick off this, I wish I would have kept count how many talked about trust,
Yes.
broken trust. Because part of my challenge to Michelle and Lynn is, hey, I'm going to talk about trust. Clearly, I think it's important, but why is it important to the medical community? You keep telling me that trust is broken. Is that true?
Mm-hmm.
Because again, a lot of do this thing called red teaming all the time, which means you're challenging facts and assumptions to try to get to, what are the real roots of problems and how do you help people get there? And I'm like, whoa, did you set this up? Because I mean, here are people that are, again, they're leaders in the field of whatever it is,
Mm-hmm.
and it wasn't just a one-off. I'm like, okay, I'm convinced now. The medical community clearly has a, you can say has a trust problem. Well, back to okay, the medical ecosystem is pretty complex.
Mm-hmm.
And even within that community, how you define trust and how you fence off the trust problem is also different. So in other words, what I learned was there is, there's patient to provider trust problems.
Yes.
There's provider to provider trust problems. There's provider to supplier trust problems. There's supplier to insurance. I mean,
Right. Yeah.
you think of again this fur ball that's connected in all sorts of different ways yeah, I mean this is a big problem.
Yes.
Not everywhere else, but within the medical community, my takeaway is okay, I'm sold. let's figure out now.
We need to do this.
The other thing that struck me was, okay, um, for those that may not be familiar with, so again, if I phrase this incorrectly, help me.
Okay.
But what this Innovation Day was about. So it was held at this medical location in Charlotte. It's the only place in North America where medical providers can come in and train on next generation robotics technology. Okay. Now, you got all these great smart people talking about the problem, and none of them are talking about the solution. Okay. And I was talking to Michelle, like, oh my gosh, you know, okay, I mean, great. We keep framing the problem. We keep framing the problem. Um what this workshop does, it actually helps attack the problem
Mm-hmm.
because it's about equipping people that are in your ecosystem to really step back and think about the problem. We can frame it in different ways, but we give you a roadmap to actually, okay, what am I going to do about it? Or what can be done about it? Because oftentimes this problem can be so big, right? Okay, global stability, national risk. I mean, my problem sets at any time were when I was a general in the Pentagon, Russia, China, North Korea, Iran, terrorist organizations, transnational criminals all at the same time, because I was a force provider to every combatant command. So yeah, problems are really big. But how do you get that is, I still have to focus on the individual soldier that we recruit every year and get them from A to B to C to D so that they're capable to be put
All those situations.
in those conditions. And so I was excited when I left. I was like, you guys got, people got to know about this because it's really a cool opportunity for people from wherever you come in the ecosystem to come and be equipped to say, you know what, I can actually do something in the areas where I have influence. So that's, again, I was excited. So hopefully, I didn't
Yes.
scare people away, but it was pretty cool to say, yeah, you guys are onto something.
You talk about, can you say VUCA? VUCA
Yeah,
environments.
yeah.
What are those? And then I want you all to tell me if healthcare is one of those right now.
Okay, so VUCA stands for volatile, uncertain, complex, and ambiguous. That's a term that in my term of art that in my old world you had to understand because of all those different threats happening simultaneously that you have to be able to prepare forces to do if the president decides to go. You need to be able to get after. You have to understand that environment before you get in it. Volatility is really about the speed of change.
Mm,
Uncertainty is about the unpredictability of change.
yep.
The complexity, just like it sounds, is the interconnectedness, interdependency
Mm-hmm.
of an ecosystem. And ambiguity is really about, lack of clarity about what is possible, to really understand what's going on. And so as a leader, again, the people who you lead, the people you influence, the people you're providing care for, they're looking to you for down and distance.
Mm-hmm.
Even if you don't know what it is, you got to be able to understand and interact with people in a way that builds their ability to be more confident
Mm-hmm.
in what's going on. And that does, again, it's not about lying to people. It's about, hey, I acknowledge it's really dangerous. We're about to jump out of airplanes. People on the other side don't like us. We're going to go in, follow me, right? It's important for you to understand what's going on so others can actually look to you. Because when they're scared, when they don't want to, it gets back to the charge of my boss, they have to trust you enough to go do some very dangerous things. And people, yeah, just ordering somebody to do that doesn't work. I mean, orders are important, and yes, they have to be able to comply with certain things like that. But before they ever get to that place, people will do all sorts of things that you wouldn't even believe in a positive way, but also in a negative way if trust is not at the core of the formation.
Yes. Yes. So I
And
can
I think,
yes.
and I was just going to add, like healthcare, we're all in our little silos doing our thing. But I think we recognize that in order for healthcare to change, we all need to work together to come up with the ways that we could reconnect with each other and come up with some solutions. Because again, healthcare is changing at the speed of light. And there's such opportunity right now because people are hungry for change.
And in
Can you
health,
tell that story about your son?
I'm going to ask another question
Okay,
first.
all right, go ahead.
Then we will. Um, in healthcare, we're so ready to collect credentials and letters after our name. But is this not the perfect time to become real trust leaders and learn what that is and then how we could do that? If we need thousands, tens of thousands, hundreds of thousands of trust leaders within healthcare right now, I think, and I'm excited about this.
There are people with, again, we all have a lot of letters after our name, but there are people that don't have any letters after their name that I would put and have put my life in their hands. There are a lot of people with a lot of letters after the name. I wouldn't trust them with a nickel in my pocket,
Ooh,
you know,
yes.
because it's not a, you'll hear it at the workshop. Those letters are important, and they are, because again, not to diminish what we all have studied and to get credentialed to do, but it's how you treat people that either builds or breaks trust. And again, think about do no harm, right?
Yeah.
In the medical community, it's we all have horror stories, but we also have some really good stories about people, who that have really cared, taken the time to move beyond the transaction and actually think about the relational care that happens.
Yes.
Whether you're in the supply chain or at bedside or behind the scalpel, there's good and bad and all that. And that's why, this workshop is going to help people really put their heads around what that means and how to operationalize that.
Excellent. And just to be clear, my point was that trust leaders better than any set of letters. And
Yeah.
so you're going to help us figure that out. So I have a question. Lynn, I'm going to ask you first and then you second, Mark.
Okay.
Why does a solopreneur, a learner, an integrated practitioner, a business leader, someone who wants to see real change in healthcare, why would these people absolutely not want to miss this workshop? Why is this a must attend for them?
I think the big reason is healthcare is in crisis right now. And how can we, as our leaders in our silos, how can we work together to really impact how healthcare is going to go in the next 5 years, 10 years? It's a broken system right now. It's on the verge of collapse, actually. And if it's not for us getting together and really looking at what are the possibilities and how we can work together and trust each other to rebuild that system in a way that we're going to revolutionize how care is being delivered. And I think putting the trust back in healthcare is really the way to do that. And Mark points out in his book, Trust is Currency. And I think coming to the workshop, you can bank that we're going to figure a different way to do things.
I love that.
So why should people come? Um, if you agree trust is important, and that's kind of a loaded statement that I say it, and I say it for a reason, because I will ask business leaders, aspiring business leaders, anybody who, has a relationship with anybody, which is like all humans, whether it's good or bad, I'll ask them, is trust important to them? And I'll get 100% agreement that it is. And then you ask them, okay, if it's so important, then who's responsible for it? Who's accountable for it? What are you doing to actually build trust in ways that are meaningful to your stakeholders? And that's when the conversation starts getting quiet, because most people don't look at it through that lens. They look at it through this it's a soft skill reactive thing that they just experience. And they do their best, but a leader doesn't look at it through that lens. They look at it through trust as a material asset. It's something I can proactively build. And when you give, when you see that you can actually do something about it, it doesn't mean that it's easy, but the fact that yes, trust can be built and you can make a decision to be a trust leader and you can impact the people's lives around you. Um, you're going to get that out of it. You're going to get the ability to understand trust differently and some tools on to be able to go wherever you, again, you ultimately have to make a decision of whether or not, you know, you want to be on the offense. And I say that deliberately because
Mm.
you've all heard of, the best defense is a good offense. We're sports fans, right? Um, Most times when you look at definitions of trust and how people frame it, it's often actually in like a victim mentality. It's a defensive lens. And those are important ways to look at it. But what I take you to is how to go on the offense, in the offense in a way that is value generating, it's relationship building, and it's accelerating to do things that are in the best interest, not just of you and your business, but yes, you and your business, but the people that your business serves.
Mm-hmm.
And I think the workshop also is going to allow us to be vulnerable
Absolutely.
in a safe space. And
Yes,
I think
absolutely.
that is such value. I think once we all get together and we start brainstorming and thinking about how we want to support, lift each other up, it's going to be great.
Absolutely. Yep.
And I'll tell you already, I had in my mind who would attend this workshop, and then just so everyone knows, there's a retreat that follows it that's going to be just for 10 leaders of leaders to dive even deeper on how within this healthcare current situation do we build even deeper collaborations. Um, the people who I thought would participate in all of this is been added to by so many other people. We have business leaders coming from maybe things that feel a little more tangential than directly medical um, related. But we also have CEOs of some really innovative healthcare types of companies from around the country. People are coming from California and Washington and Amy from Mexico, and we have a dean coming from Creighton University, and we have a CEO coming from Washington, D.C., and people coming from all around. So that the richness of the conversations at those tables is going to be incredible. And so we're very excited about it. It's going to be on June 2nd in Cary, North Carolina. It is right near the airport. So if that helps anybody to kind of do, I know a few people are doing a fly in and a fly back out in order to be there for the afternoon. Now I have another a story I want you to hear. So General Towne, your son, is getting his MD PhD,
Yep.
and he had an experience that talked about trust and professionalism and
Yeah. Well, okay. Yeah. So when I was a colonel, I was stationed in New Jersey, and it was that 42,000 person organization I was leading, and we had relationships with the community because again, as an employer like that, we and there was this um, my son was an undergraduate at the time in Texas. He was home on, I think it was Christmas break, and I arranged for him to have the opportunity to do a shadow opportunity with a cardiothoracic surgeon that worked short, little off the base. And he got to go in the operating room, all gowned up to be in there during an open heart surgery. And it was really a powerful experience for him. You got to see the entire surgical team, all the stuff that happens before, during, and after. So when you think about teams, right?
mhm.
Again, I mean, it's not just this person. I mean, it's an orchestra that he got to see put together. But what really struck him was before the procedure. Um, the patient was very much overweight, and there were people on the medical team that were basically, being very disrespectful in what they were saying about the patient. My son's sitting there just listening to all this. They do the surgery, and as they're leaving, the perfusionist takes my son aside and looks at him and challenges him. He said, "You're going into a profession where people literally put their lives in your hand. They have to trust you. And that trust goes both ways. Not only do you have the duty to become the best surgeon you can possibly be, but you have to remember to treat them with dignity and respect, even when they can't hear what you're saying."
Mm.
Now, I get it, there's oftentimes, hey, there's a thing about, people being overweight, and there's some difficulty sometimes when you got to do things in surgery, but this wasn't that. This was the perfusionist clearly saw, this did not take part in that conversation.
Mm-hmm.
And I'm grateful that this person was wise enough to acknowledge it, see that you have this young person in here, and took him aside and challenged him. And to this day, that story sticks with him. Again, he's still, a 28-year-old male that does things that dad's stupid. And I don't, we don't, but I love him to death. But that made a big impression on him. That trust in the operating room, trust in the medical profession, trust, it's this profession has a responsibility to be building trust, even when when no one's listening,
Mm-hmm.
or when the patient is hard, difficult to deal with. As a soldier, yeah, people don't like what you're doing sometimes, but you got to go, you got to do it, because that's part of being a professional. And values driven, is at the core of this profession. And so, yeah, that's a story that hit me personally about, you know, people are also human.
Mm-hmm.
And so we have a choice. The surgeon had a choice. Whoever was coordinating all that had a choice, but they weren't thinking about it. And they're good people, I'm sure, but
Yeah,
fortunately for him, the perfusionist saw what was going on, took him aside, and that made a big impact. We all have an impact when we take the opportunity to be trust builders versus trust breakers.
absolutely. Yes, Benita.
Hey, I'm a physician. I'm a OBGYN, so I am a surgeon. And that story is so impactful. I love that they pulled your son to the side. Um, when I go into the OR, when my patient's going to sleep, I'm at the bedside with my patient, if I can be. I'm holding the patient's hand as they go to sleep, which to the team sends a message that I care about my patient. I'm here for her, and we have this my girl. Like, don't we're here for my girl, right? And I learned that from a mentor. I'm creating something which is, I think, a solution to help the medical system. And I think you said it, Lynn, we don't trust each other as providers. I love that the perfusionist pulled your son aside, but who pulled the surgeon aside and say, you're a butthole?
Yeah.
Like, this culture is toxic.
Mhm.
Yeah.
If that person could hear, and I've had patients who've heard, they thought they were asleep,
Yeah.
and they heard the surgeon talk about them. How does that make the patient feel? Would you want somebody talking about your mother? And so, I'm going to be in a position where I am a physician patient advocate, but I'm asking physicians, nurse practitioners to trust me. And oftentimes they're looking at you like, who are you questioning my management? And so I think a part of this system needs to be leveled so that we can critique one another, because what the perfusionist saw is probably not what the cardiothoracic surgeon or team, maybe they probably, they are known to be buttholes, I will say that, among surgeons, but they probably don't understand the ramifications of that.
Mm-hmm.
Yep.
Like it was just like there was a time when surgeons could throw instruments, and that went on for a long time. Like that's shenanigans. Like, why did it take us so long to say, get your act together? You're acting like a toddler. So I don't know. Rebuilding trust amongst the providers and the people who actually provide the care, I think is going to be very important. And I'm wondering, in the workshop, will you all be addressing that component? Because we are siloed. Nurses talk about doctors, doctors talk about nurses, phlebotomists talk about the nurse. I mean, everybody's kind of in their separate teams, which
So,
doesn't allow us to work together well.
so that's a great way to frame this, because the short answer is yes, we're going to address it. And I may not address it in the way you might think sometimes, because as you're talking about, you know, I mean, that's human relationships, right? I mean, you put a soldier and a Marine in the same, same place. They're going to hate each other. But they're going to fight with each other. They're going to say bad things. There's rivalries, right? Sometimes it's positive, sometimes it's negative. But I'm going to introduce you to the source code: values, education, training, and sustaining, which it. How do you change a culture? Well, again, you really have to start with values, because I can't, so I was in the banking industry, right, for a while. Everything's about managerial controls, right? You've got quality systems. How do you force compliance to certain things? Well, in the military, there's a lot of compliance too, to policies, procedures, that happens. But at the end of the day, you can't policy and comply yourself out of the things that you're talking about, because humans are humans.
Mm-hmm.
But what you can do is, if you establish a values framework, it becomes, I talk about vectors and boundaries, what real operate, not aspirate, and I differentiate between aspirational and operational. Because once you understand what your operational values are, they become very powerful in influencing behavior. And we'll go into why that happens and how to do that. And what you'll come away from the workshop with is, you'll understand, if you haven't done this already, but you'll have a clear picture of what your operational values are, how to look at your own institutions and the people you interact with. You can look at them through a values lens, and it's not to convict or condemn anybody. It's to understand what's driving people. In short, we'll go into E. The E for Vets leadership stands for education, and it's not about the number of letters behind your name. It's about exercising intellectual curiosity about people who are different than you, may not have the same value set, and so that you can create shared understanding. And again, this is not transaction. This is about it's about building relationships that actually get at what you're talking about. And then the T is where you actually create scenarios where people take what you just described and highlight. So if let's take the cardiothoracic surgeon, for example, and you're absolutely right. If I'm the perfusionist, I've just talked to this young man, but I'm going to come out of there and I'm going to, how do I influence that this should never happen again? I may talk to the surgeon. The surgeon may not like what I hear, or are there are ways to get at it to make, this actually violates. Not, so let's say I'm the surgeon. You know what? You may not like what I want to hear, but it actually violates our oath to the profession. There are ways to handle it. And again, I got all sorts of war stories about using values during conversations to actually changes people's behaviors, because it makes it more than just the transaction of the moment. It actually brings the impact of their actions to a higher level of, wait, this isn't just about me. It's about people around me. It's about things that actually ultimately affects me.
Hmm.
But when you start having values conversations and values in action scenarios, that's how you get at the problem set that is so complicated, is so interactive. When people say, "Hey, I can't do anything," well, actually, you can. You can when you understand your values, you control your own behaviors, and you start to influence others just by the behaviors that you set forth. Is that so? Yeah, you'll get that. You'll get a lot of that. And if that interests you, then and if I would encourage anybody who really wants to solve problems, I mean big problems, uh, this vets leadership approach helps you get your mind around how to do that.
What are you all hearing? What about this do you think is needed? If you were talking to someone else about this workshop and whether they should attend, what is grabbing your attention? Hey, Irene.
What I see is an opportunity for people from all walks of life to come together and pool their knowledge and experiences and, um, coming one thing that's really important to me now after having um, been associated with the medical system as a daughter-in-law of my mother-in-law, and seeing what happened in the healthcare system. Um, there were some people that we encountered that were great and supportive and helpful and kind, and other people, uh, it's like, why are you saying that? Just get out of the room. I don't want you around her, type of thing. So Benita, to go off of what you do as a physician, you're I kind of get the sense that your patients know, or the people you care for, the women you care for, if they are going under anesthesia to have a procedure done, that they know that you care. And I think that's so important. I mean, building trust not only between, healthcare providers or people, CEOs that, have like insurance companies or whatever associated with the, medical care. Um, but also being able to build that trust with the people we are taking care of, you
Hmm.
know, and talking about the healthcare system being broken. I agree with that. And especially right now, I mean, there's so many options that have been taken away from people, you know, just because of choices that other people in power have made. But knowing that, you know, there are people that care about them, and just building that trust. And then who knows, you may be working with a 5-year old and, you know, their family and stuff like that, but then they grow up like your son Mark, um, to become a healthcare provider, and just, you know, the value that he got from what the perfusionist said. So I see a lot of value and a lot of opportunities to grow and make
Thank
some changes, that need to be made, that will make the world a better place for everybody.
thank you. Is there anything that leaves anyone skeptical? Like whether it would be a good thing for others to attend? Maybe something that you were expecting to hear about that we didn't touch on?
This is Kimber. I'm definitely excited about it. Like the discussion and see it would definitely helping. I think since you have entrepreneurs on the call. I guess I'd like to hear more about from the entrepreneur, business owner perspective, thoughts on that, because it sounds very good about healthcare collaborating, and just would like to hear, not necessarily now, but like in the workshop, how it applies to small business owners like that we are.
Yeah, that's a great question, and I'm glad you brought that up because part of it, again, I did a lot of research after I left the Army, talked to a lot of business owners, and like I said, there's peer-reviewed stuff on this, there's trade literature on it. You know, the ability to build trust is actually a business. It is a material asset, is a competitive advantage in business. Deloitte, for example, found that trusted companies outperform their peers by 400%. If you got, looking at recruiting and retention, 79% of employees who trust their employer, they're more motivated to work, and less likely to leave. You name the consulting firm, the People Leadership Institute, they're all studying this because they know that it's a competitive advantage. Branding, right? So we'll talk a lot about this stuff too, but the point being is when I talk to business leaders, and that's why they'll 100% they'll say trust is important. It's critical to my business. The data is out there to show that just believe me, because one of the challenges with any business, right, is you still got to make your bottom line. Your metrics have to be going in the right direction. You got to get that transaction. But here's the deal: is you can actually do that in a trust-breaking way, and your business isn't going to sustain. If you want to be in it for the long run, trust that's limited. It's currency. It's the ability to get your brand out there. People will actually pay a premium to do business with organizations and people they trust because they know that, again, you're going to look out not just for the transaction, but the interest of your business. And that's hard, especially when you're trying to sprint, you're trying to make you make your payroll or make your own mortgage payment if you're a solopreneur. But you know, if you can build trust in what you deliver, um, the odds are you're going to, again, I can't guarantee it, but the odds are you actually increase your likelihood of success if you go in through things. Not, again, the transaction is important, but look at the relationships that are going to lead to referrals because people trust you. So anyway, we'll go deeper in that, but that's a great question. Kimber, did I say that right? Yeah. So thank you for that.
Michelle, your question was, is there anything that makes us skeptical about the workshop? Is that right?
Yes.
So I think I'm always skeptical. Well, let me just say that we, as those who are patient facing, especially delivering care and our boots on the grounds, we all know the system is broken. And I think part of the reason that we think it's broken is because the people who are looking at the bottom line are the ones who are steering the ship. And so anytime you bring, it's a very difficult dance when you're bringing bottom line to people's lives. And I will just say, I'm sure for all of the professionals here in medicine, it's a calling. It is not a transaction. It is not a referral. Like they've got to trust me, not because I want their business, but because their life is in my hands. Like that's what it is. And I feel like when you get the business segment together and medicine, there's really this disconnect, and those systems, I guess they'll have to overlap, right? Because businesses have to make money. But sometimes they want to bring a business model to a human issue, and they just don't fit. And I've been in several of these conferences, and I'm like, that doesn't work in healthcare. Like a woman is postpartum, she may be having postpartum depression. It's not a 15-minute visit anymore. It's a 45-minute visit. Yeah. So now I've just blown up my schedule, and the bottom line is affected. And I can't say oh, well, ask me one question and we'll talk about that next time. Like it doesn't, there's not a match there. So that's the only thing that makes me a little skeptical. And I know, especially in the military too, General, there's also buy-in. People, you tell them what to do and people do it.
Yeah,
And
yeah,
with
but they
patients,
won't,
that is not the case.
but they won't do real hard things. Back to the, will they do something that puts their life at risk, and they know it's not going to work out well? Will they still do it? That is a trust equation. But I want to pull a string on what you said because it's again, those type of things are really important to not leave on the sideline. And so when you with vets leadership, the E in vets leadership, again, about intellectual curiosity and shared understanding. It's not about coming to agreement. What it is, because we all come from it from and you laid it out beautifully. You've got, you know, the provider perspective, it's a calling, it's a profession. You've got other parts of the ecosystem that, somebody's got to pay a bill, right? Somewhere in the equation, someone is ultimately paying a bill. But
Yeah.
but we don't blow by that. We talk about it. We work on trying to understand it because what often happens is we entrench in our own problem set as opposed to, okay, what is in the art of possible? What can we do? And that's, so those type of things, there's an exercise we're going to do that's going to get at, okay, you know what? I have a certain world view on something. Let me take the opposite perspective and try to make the case. So I understand. Again, I may never agree with it, but at least I understand this. So because now what we can actually do is we can work through the different assumptions that some that we might be
Right.
treating as fact, or find new facts that can actually help us understand each other better, in that problem. Because if we don't bring people together in that, then all you do is you create friction that you can't lead, well, it's more difficult to lead through. So anyway, those type of conversations are exactly the type that we're hope to have in some of these forums.
Thank you.
Any other comments or questions? Thank you all. We've used your hour. Thank you so much for being here. What are three takeaways?
So the three takeaways about the workshop. What is the value proposition for anybody, regardless of where we come from in this ecosystem? What Build Trust does in the book, and when I talk about it in workshops and with companies, is help you actually think differently about trust, to have a better understanding of the trust ecosystem. Two is not only are you able to think differently about it, it's going to equip you to actually do something about trust. And the third thing is hopefully it inspires you actually when you leave the conference is take what you've been equipped to do something. And only you can see where that's going to apply in the ecosystem in which you live and lead. But it's going to give you the opportunity. You think differently, equip yourself to do something, and inspire you to take action when you leave so that you can be a trust leader in whatever it is that you do, wherever it is that you have influence. That's it.
I love that. Please help us spread the word. Like and share some of our social media content or share your own. Let me know if there's anything you need in order to share. We really want to pack the room so that we can have these very rich conversations.